You can, Rahul, you can issue that medicine and show the result here.
Okay, sir. So the pharmacist can use issue by online prescriptions if doctor has prescribed in the clinic. So pharmacist can select the store and can enter the UHID of the patient, and by clicking on the show patient details, so the whatever medicines prescribed by the doctor, the pharmacist can see. And now the pharmacist can issue the medicine by clicking on this hyperlink. We can see the doctor name also with the patient name, UHID, date and time. By clicking on this hyperlink, now pharmacist can uh, prescribe the medicine, issue the medicine. So for the paracetamol tablet, we have different types of batch number available. So we can give using any batch number. Also, we can see the expiry date of the medicine, stock in hand. Also, we can use the autofill, so it will automatically fill whatever quantity the doctor has prescribed. And by clicking on the list, and by clicking on the next and generate receipt. So record saved successfully, and receipt number is this. So by this way, the pharmacist can issue medicines online if doctor has prescribed in the clinic. Also, doctor can see the dispense quantity in the clinic.
So this is the final step. So the labs treatment అయిపోయింది, the reports చూసేశారు, medicine కూడా dispense off అయిపోయింది. So this is how the entire treatment for the patient can be viewed by the doctor online from anywhere, not only from hospital but from anywhere. From anywhere you can see this 24/7. Okay. So any doubts, any things from the doctor's fraternity, you can just open up. Rahul, would you like to add some other points?
No,
IPD,
sir, I
yes,
think
going to the IPD part. IPD part.
okay, sir.
సో సిమిలర్లీ ఇప్పుడు ఓపీడీలో ట్రీట్మెంట్ ఎలా చేసామో ఐపీడీలో కూడా అలానే చేస్తాము. కాకపోతే ఒక చిన్న డీవియేషన్ ఏంటంటే ఐపీడీకి మీరు తీసుకున్నప్పుడు పేషెంట్కి మీరు రూమ్స్, బెడ్స్ అలాట్ చేస్తారు. సో ఆ అలాట్మెంట్ అయిపోయిన తర్వాత మీరు ట్రీట్మెంట్ అనేది సేమ్ ప్రొసీజర్ స్టార్ట్ అయిపోతుంది. సో బెడ్స్ అనేది ఎలా అలాట్ చేస్తారు, సో జస్ట్ మీకు ఒకసారి వేరియస్ ఆప్షన్స్ ఉన్నాయి. దాని తర్వాత న్యూ బార్న్ బేబీస్కి ఎలా చేస్తారు, దాని తర్వాత డిశ్చార్జ్ సమ్మరీస్ ఎలా రాయాలి, ఇవన్నీ కూడా మీకు చెప్పడం జరుగుతుంది ఐపీడీలో.
So
Yeah, go ahead.
in IPD admission, we have a first link existing patient. So we can admit a register patient. So we can enter the UHID, and by clicking on the show patient details, the patient details will be appear whatever we have captured during the registration time. And we can capture the admission information. If patient is MLC, then we can select yes or no. Also MLC or non-MLC we can select during the registration. So also we can see the referring department, anesthesiology. We can select the department wherever we want to admit the patient, and the all unit that we have added under the anatomy, that will be reflected in this drop down. We can select it, and the whatever ward is mapped with this unit, anatomy unit A, that will be reflected under the ward drop down. We can select the ward, and whatever beds is we have added in this anatomy ward A, that will be reflect in the bed drop down. So we can select the bed type beds, we can select the bed, we can allocate the bed. So basically this template is ndmc template. So in this template we can allocate the beds to the patient. But if you are using triple R template, so on that template we cannot allocate bed to the patient. Only we can add up to ward label.
సో ఇప్పుడు పేషెంట్‌కి రిజిస్ట్రేషన్ టైమ్‌లోనే బెడ్ అలాట్‌మెంట్ ఇవ్వాలంటే ఈ టెంప్లేట్ యూజ్ చేయొచ్చు. అలాట్‌మెంట్ టైమ్‌లోనే బెడ్ అక్కర్లేదు అంటే మీరు ఈ టెంప్లేట్ కాకుండా వేరే టెంప్లేట్ ఉంటుంది. ఆ టెంప్లేట్ మీరు యూజ్ చేయాలి. ఓకే. సో ఇక్కడ ఎన్ని వార్డ్స్ మీ దగ్గర ఉన్నాయి, వార్డ్స్ డిపార్ట్మెంట్స్‌కి సంబంధించిన ఎన్ని యూనిట్స్, ఐపీ యూనిట్స్ ఉన్నాయి అన్నీ కూడా మీకు నోడల్ ఆఫీస్ దగ్గర కాన్ఫిగర్ చేశారు. దాదాపుగా జీజీహెచ్ విజయవాడలో 40 ఆడ్ డిపార్ట్మెంట్స్ యూనిట్స్ కాన్ఫిగర్ చేశారు. అలాగనే వార్డ్స్ ఎన్ని ఉన్నాయి మొత్తం ఆ యూనిట్‌కి సంబంధించిన వార్డ్స్ అన్ని కాన్ఫిగర్ చేశారు. బెడ్స్ కూడా కాన్ఫిగర్ చేసి ఉంటారు. సో అన్ని బెడ్స్ ఏదైతే ఉన్నాయో 20 బెడ్స్ కానీ, 30 బెడ్స్ కానీ, 10 బెడ్స్ కానీ ప్రతి వార్డ్‌లో ఈవెన్ ఇఫ్ ద బెడ్ ఈస్ నాట్ అవైలబుల్ యూ కెన్ అడ్మిట్ ద పేషెంట్ ఆన్ ఫ్లోర్. సో మీకు రైట్ సైడ్ మీరు చూసినట్టయితే ఫ్లోర్ ఆప్షన్ ఒకటి ఉంది. సో బెడ్స్ కనుక అవైలబుల్‌గా లేకపోతే పేషెంట్‌కి మనం ఫ్లోర్ మీద కూడా అలాట్‌మెంట్ ఇవ్వచ్చు. సో దిస్ ఈస్ ద వేరియస్ ఆప్షన్స్ వెన్ వి ఆర్ రిజిస్టరింగ్ పేషెంట్ మనం ఐపీలో రిజిస్ట్రేషన్ చేసేటప్పుడు మిగతా ఆప్షన్స్ ఇవి. ఓకే, గో హెడ్ రాహుల్.
We can select the treating doctor also, and by clicking on the save and generate ticket, one admission slip will be generated. Also we have two different types of admission slip, one is A4 and second is ticket size admission slip. So patient will get a IP number, inpatient number, we can see the unit, ward, treating doctor, date of admission, and the all demographic details of the patient on this slip. We can also take the duplicate.
సో మీకు ఓపీ
Next,
రిజిస్ట్రేషన్ ఎలాగైతే జరుగుతుందో అదే రకంగా ఐపీ రిజిస్ట్రేషన్స్ కూడా సెపరేట్‌గా జరుగుతాయి. ఎస్.
next the module is newborn baby. In this we have a link search newborn baby. So we can capture the details of the baby after delivery of the baby. So we can select that ward wherever patient is admitted. So we can select the patient, and now we can capture the baby details. So we can capture the gender, male, female, or other, delivery method, normal delivery or LSCS. So different types of values is available in this drop down. If abortion, so as of now I'm selecting normal delivery. We can select the department, unit, date is automatically coming. We can select the time of delivery. If it is abortion, then we can select the abortion checkbox. And by clicking also if baby is single, twin, or triple, so we can select in this drop down. And by clicking on the save button, so that the baby details will be saved. Also baby will get a unique health identification number. So now using this UHID we can admit the baby in the hospital. So by clicking on the admit button, we can admit the baby by selecting the department, unit, ward, bed type, we can select the bed number, treating doctor, and save and generate ticket. So the baby, we can also admit the baby. So we can see the details of the baby. Also, mother, we can see the mother's ER number. So by this way, we can capture the baby details, and we can admit the baby in the hospital. Similarly, we can capture the all details of the as we have done in the clinic in treatment. Similarly, we can do the same process for presenting illness, for the physical examination, allergens, order entry, diagnosis. If we want to cancel the service, if a doctor has prescribed any services, if we want to cancel it, so we can cancel that. So the treatment part is similar as we have done in the clinic. If we want to transfer the patient in another department or another beds or another ward, so if we are using a triple R template in the hospital, so we can allocate the bed to the patient by using bed allocation in transfer. So in anesthesia ward B, as of now, two patients have not allocated any bed, so we can allocate beds to this patient. So by clicking on this radio button, we can select the bed type beds. The all beds will be available and we can allocate. By clicking on the allocate, the bed will be allocated to this patient. So now we can see now the bed number 8 is occupied. Also, if we want to transfer patient in department or unit or ward or bed, so we can transfer the patient by entering the UHID, by selecting the patient. We can select the ward. As of now, patient is in anatomy ward A. If we want to transfer in anatomy ward B, we can select the bed type beds. We can give the bed number, treating doctor, and if patient is diabetic or HT or BT, we can select. Also, we can enter the transfer region, and by clicking on the transfer, now patient will be transferred with this CR number. If we want to see the status of that patient, any patient status we can see by using the search patient. So now we can see now patient has been transferred into the anatomy ward B on the bed number 10. Current status we can see admitted on this 14th March 2022, admitted by doctor name. After release, the doctor name will be available. Similarly, we can add the notes for the particular patients. If you want to add any comment, so notes type would be doctor note or program note. It will be routine or urgent. We can enter the notes. We can view, or we can also add the multiple notes. So we have two way process of transfer. One is we can directly transfer patient to any department or any ward, and also we have one option, we can request to the ward or department for the transfer. In this case, we have to verify the transfer. Also, the respective department or ward can be cancelled. So process will be same for the both. Now the next process is of discharge. So for discharge, we have discharge type like normal discharge, DOR case entry, discharge on request, LAMA case entry, left against medical advice, absconding case entry, missing from IPD case entry, denied admission after BHT, pending patient status updation, transferred to cabin or ICU or other medical department or ward or unit, discharged by referral. Also, in the case of death, we can issue the temporary death certificate to the patient. After that, we can move to the death case entry and the form 4 generation. As of now, I'm going with the normal discharge. So we can enter the UHID of the patient, and by clicking on the go, now we can click on the notify discharge. So I have not captured anything in treatment, that's why it is not coming. If we have captured the details, complaints, and the diagnosis, the all uh, details will be come automatically. Don't need to enter details in notified discharge. If we are uh, capturing the EHR details in the treatment, so that all details will be appear automatically in the respective fields. And select the doctor, procedure name if any, operative findings. If any operation is there, we can select the date, surgeon. Also, we can select the next visit date. As of now, it is showing bill settlement is pending. So in billing, we have a configuration. We can discharge the patient without billing. We have a configuration. We have a mapping in the billing, parameter configuration in billing. Settle bill without discharge or with discharge. Settle bill with discharge. So we can configure that. Also, by seeing this notification, the nurse or the doctor can tell the patient to go for the bill settlement first. So after the bill settlement, in on front of bill settlement, receipt number will be available. So by clicking on the notify discharge, it will be saved in the draft multiple times. The doctor can edit. So we can see multiple times the doctor can, if you doctor wants to edit the report, discharge report, then they can edit. After that, verify discharge. Discharge and print certificate. If they want to edit anything, they will be able to edit. This is the discharge summary report. After that, we have a death module also. If in the case of death, first we have to issue the temporary death certificate to the patient. After that, we can go for the death case entry and form 4 generation. So this is the process how we can admit the patient, how we can capture the details of the baby after delivery, how we can transfer the patient, how we can capture the EHR, how we can check the status, how we can check the how we can give the nurse note,